Recently, we have also seen a rise in cases in Edmonton. In the past 3 weeks, the number of active cases has risen from 58 to 149. While any increase is concerning, there has been no single source or cause identified. About 2/3 of these cases are linked to known sources or outbreaks, and about 1/3 are not yet linked to a known source. We are watching these cases closely and will communicate to Albertans if there is any cause for alarm. I have been asked if the increase early this week might partially be the result of recent protests in the city. I can tell you that is not the case, as any transmission would take days to work through the system. We have seen a rise in our testing numbers in the past few days, as those who attended protests have responded to my recommendation to be tested. But to date, we have not identified cases where attendance at a protest was determined to be the source. Having said that, it is important to stay vigilant. The freedom to protest is a critical one, and preventing the spread of COVID-19 is also critical. We have worked with several of the groups who organized recent demonstrations to put together a guidance document for organizers and attendees with ways for demonstrations, marches, and rallies to accomplish both goals of raising voices and preventing spread. Options include using virtual means, car rallies, and groupings of 100 with distances between the groups. I would like to remind anyone participating in any future demonstrations to stay 2 meters away from one another and to wear a face mask while attending. I also strongly encourage anyone who attends a protest or any other large gathering to download the AB Trace Together app. This will help speed up contact tracing should a case be identified. I know that many people are excited that Stage 2 has arrived and that many others are wondering what this will mean for our province. Will we see increases in cases and new outbreaks? If so, how do we respond? It is important for all of us to remember that this virus is not gone. COVID-19 is still circulating in our communities and will do so for many months to come. With the increased opportunity for activities and gatherings, there is increased potential for all of us to be exposed to COVID-19. Over the past few weeks province-wide, we have begun to see a younger demographic testing positive for COVID-19. 60% of our currently active cases are under the age of 40, and we are seeing a particular increase in those between 20 and 29. It is important for younger Albertans to remember that while you may not be at risk for severe outcomes of infection, your actions are critical to protecting those around you who are at higher risk. We are all in this together, and we have never needed each other more than now in this relaunch time. What we're seeing in the cases that have been investigated over the last week to 10 days is that people are, I think, feeling encouraged by the restrictions being lifted and perhaps maybe going above and beyond what was intended by the restrictions being lifted. So we're seeing social gatherings, we're seeing parties and celebrations where people are coming together, sharing food and drink, enjoying each other's company after having been apart for a long time. And again, I want to emphasize that it is completely natural that we all would want to enjoy social interaction after a time of having been apart. But the important thing to remember is that COVID has not gone, and it will not be gone for some time. So the common pattern, again, seems to be more socialization, getting together in groups and sharing food and drink, and not maintaining that 2 meters of distance. And also, I think the other reminder is that when someone is feeling ill, that they should stay home, they should not go to a party, they should not have a party, because really when people are feeling ill, again, that's where there is a higher likelihood that they may spread infection. Having said that, I again want to say how deeply, deeply grateful I am that those who are feeling ill are going to be tested, because the last thing that we would want is for those who feel ill to be out and about, to be interacting with people, but then feel ashamed and not get tested, because then we would not have the opportunity to stop those chains of transmission. So again, I want to remind people, if you are feeling sick, please stay home and get tested and make sure that we can then work together to stop the spread.